Let's discuss some suggestions for success. Some things that you want to eliminate in your speech and written word are cliches, euphemisms, sexist language, profanity, and insensitive language. First, let's discuss cliches. Cliches are phrases that have been overused. I have two examples here I want to show you, and they are, you can't judge a book by its cover, and what doesn't kill you makes you stronger. These are two common cliches that you see all the time. They have been overused. What I want you to take away from this is that you want to avoid cliches whenever possible. Use different language. Use different written word. Try to avoid using cliches. Next, let's discuss euphemisms. Euphemisms are using language that is mild to explain language that may be more harsh. An example of this would be moved on to a better place versus saying died. Moved on to a better place is your euphemism. And it's using moved on to a better place to explain the harsh term of died. That is the first thing you want to take away, which is avoid using euphemisms. The next thing you want to always do is be honest and accurate. Next, using euphemisms can be seen as unprofessional. For example, if you're explaining a body part or a bodily function and you decide to use a euphemism to explain it, that can come off as wrong or unprofessional. So, once again, be accurate, be concise with your words. Avoid using euphemisms. Next, let's discuss sexist language. Sexist language is when men or women are excluded from the topic being discussed. Typically, men tend to be the default, meaning his tends to be used more than hers in our language. We can do this by using gender-neutral terms. Instead of using policeman, use police officer. Also, don't say male nurse or female doctor. Only use the sex, such as male or female, when it is absolutely necessary. If it is not necessary, just use nurse or doctor. These are a couple takeaways that you want to keep in mind. Next, let's discuss profanity and insensitive language. There are three takeaways that I want you to leave with here. And those three are, watch what you say, be sensitive, and be respectful. Why are these three things important? Well, first of all, you want to watch what you say because A, what may have been appropriate 5 years ago may not be appropriate today. Also, what may be appropriate within your circle of friends or in different groups is not necessarily appropriate in the workplace. So you always want to be careful of what's coming out of your mouth when you're working and when you're with patients. Next, you want to be sensitive. And the reason for this is because language matters. So you want to be very careful not to exclude or emphasize a person or group of people with references to race, sexual orientation, age, gender, religion, or disability. Just be careful with what you say because you never know when it's going to offend somebody. Next, be respectful. If you are respectful toward everybody, most likely you're going to be okay and you won't have to worry about profanity and sensitivity. Just treat others the way you want to be treated.